Hey, this is Lee Welch with the Running PTs. Today we're going to be talking about hip pain, more specifically lateral and posterior or side and back of the hip pain, not the front of the hip. So we see a lot of injuries occur in the side, the back of the hip, in the sit bone. Those are all different injuries and all have different presentations, but there's some overlap in terms of where they come from. One of the things we see is lateral hip pain. There's a muscle on the side of your hip called your 𝘗𝘩𝘺𝘺𝘢. What that muscle does when it contracts is abduct or lift your hip to the side. But that's not what that muscle's for. What that muscle's for is when you stand on one leg, it prevents your hip from dropping. So you would think intuitively, one of the drivers behind this injury is a lot of pelvic drop, a lot of pelvic collapse back this way, increases the load or the demand on this muscle and causes it to become overused. This injury responds really well to dry needling, and almost every time a gait analysis is indicated. For pain in the back of the hip or piriformis syndrome, we'll call it that. There's a lot of muscles back there it could be, but for the sake of simplicity, we'll call it piriformis syndrome. This muscle, again, is responsible for stabilizing when you're on one leg. When you're running, you're never on two legs, you're always on one or none. The muscles in your glutes are working really, really hard to stabilize and control you. So it's really common to develop strains back here in the back of the hip. This also responds really well to dry needling. It also responds well to foam rolling. We have a video called a foam roll hip series. You can see how to roll that muscle in that video. With this injury, namely piriformis syndrome, a gait analysis is also indicated. There's usually a form component to this injury. We oftentimes see patients that have been dealing with this for a very long time. We can fix those individuals in a relatively short amount of time with deep tissue, dry needling, some strength work for the hips, some foam rolling at home, and usually working on run form. We also see a lot of hip pain manifests itself on the sit bone. Your hamstring's attached to this bone that you sit on when you sit down. It's called your ischial tuberosity. That injury is called high hamstring syndrome. So that hamstring tendon, where it attaches to the bone, is a common place to have a running injury, particularly in runners that sit back quite a bit. And the reason is that when you get into this position, it lengthens this tendon, and that sit bone wedges into the tendon from the inside out a little bit. So you get this effect of having stretch and compression on the inside. It's a very common injury. It's very fixable, but I oftentimes see runners doing the wrong thing for this. Almost never is stretching indicated for this injury, in my opinion. This injury needs consistent strengthening, tendon strengthening, in extended position. So no strengthening in flexion, but strengthening with the hip in extension, so the hip straight early on. Progressing the strengthening to the point where the individual can do things like deadlifts and squats and run without pain. That's a natural progression. You start with strengthening and extension and progress to strengthening in more hip flexed positions. This injury typically responds really well to dry needling to stimulate healing of the tendon, along with that progressive strengthening or progressive loading. A gait analysis 100% of the time is indicated. I almost always see form impairments with high hamstring syndrome. We can help you with any of the hip injuries that you may experience on the side or the back of the hip at the Running PTs. Go to our website or email us if you'd like help with any of these injuries.